Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com.
Aloha, Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Well, there you are. Welcome back. Nice to have you with us. If you've not been with us before, Vein Clinics of Hawaii. Statewide, started on the Big Island, as a matter of fact, worked its way here to Oahu, and we about a year ago we started doing this radio show, and it's getting pretty interesting because not only are we finding out about all the different kinds of vein disease there is, and the cosmetic look of it, and the medical look of it, the life enjoyment and the life threatening, all of that stuff, but we also find that there's a lot of other things going on at Vein Clinic's office. And as I've been there as a patient, often, I see different things going on, and I got real curious about them. So I asked the doc particularly about some of the stuff that he was doing with lasers, and not only in vein surgery, but in other things. And before we introduce our special guest for the day, Doc, I thought it would be kind of neat to talk about, before we talk about laser, talk about ultrasound for just a minute, because this is a device that is now used literally in every medical practice and every different thing, and ERs and everything else. And it was kind of new to the mix. So if you know a doctor that's been a doctor for 30 or 40 years, he didn't have an ultrasound at his convenience, and neither did people in the vein business.
Absolutely right. Yeah, it's one of those things that has made medicine and many facets of medicine, diagnosis as well as treatment. I mean, we use ultrasound not only to diagnose the problem, but we use it very extensively when we're actually doing procedures.
I saw this.
Patients.
I saw this one thing with you where you put this little ring on my leg, and it like takes a picture through your skin.
Yeah,
and isn't it in many respects? I mean, what used to take diagnostically a long time to investigate, sometimes actually having to cut somebody open to see what's going on.
Sure.
Now you can take this device and okay. Now, that being said, it's used everywhere, right? In ERs, right?
Mm-hmm.
And certainly in the OBGYN's office to see that little baby and all that's going on.
Yeah.
Now, sometimes the ultrasound is used as a guide to look inside my leg so that you can use a laser to do a treatment of my leg.
Right.
Explain that. That's above my pay grade.
Well, it's a combination of two very high-tech kind of devices that we have these days that, has made treating patients much easier, much more efficient, as well as much easier for that patient. When we think about vein disease, as we've talked about many times, our parents and grandparents, et cetera, if they were going to have their veins treated, they went in the hospital.
Sign you up, Bring extra clothes, you're going to be here a while.
And, it was very invasive. And now we do things very minimally invasively. And you're right. Even with respect to diagnosis, particularly in regards to vascular kind of problems of all sorts, the ultrasound has taken it from a invasive kind of event to a completely non-invasive event, and not only is it easier, but it's giving us much better imaging of what we're looking for.
Okay, now, so you take that as a build-up to what we're going to talk about today, and that's a laser. And there certainly is a laser been used on my legs, and there's really a lot of things being done with laser. A dentist friend of mine is using a gum guy is using a laser, and this is it looks like this is the tool of the century, doesn't it?
Yeah,
this laser.
Laser laser is just an energy source.
Mm-hmm.
And so the question is, how do you use that energy source? Where do you put that energy source? And what is that energy source being directed to? But yeah, you're right. I mean, there are lasers that are used topically for one reason or another. There are lasers that we put inside the body to, achieve different things. And yeah, when we're treating vein disease, we use laser as well as other energy sources because basically that's all we need. We need an energy source directed, somewhere to treat vein disease, and we've been doing that for a while.
What's interesting to me is that there are many cases now where these lasers are being used, and they seem to be developing new applications every day.
Yeah,
which is really good. I mean, so someday you're going to be able to have a laser tune-up on your car. I mean, it's that valuable of a tool.
Right.
So let's talk about maybe some of the things today with our special guest, who's your RN, Taylor Busker is her name, and she is. Has worked with me as a patient and also does some other stuff. I don't want to say fun stuff, but certainly more fun than dealing with a leg ulcer, right?
Yeah.
So let's talk a little bit about what are some of the things that are going in your office besides vein surgery.
Yeah. Well, it was kind of a natural progression. We treat vein disease, and as you've mentioned, there's a huge spectrum of vein disease. Most of it is needing to be treated because for medical reasons, but there are people that come in with vein problems that are purely cosmetic.
Sure.
And we've been doing that. So as we have sort of evolved, we wanted to offer to people more, cosmetically directed kind of things. And in a sense, it is fun because you're ultimately achieving a better quality of life for that person, a little better self-image.
I was going to say smoking hot self-esteem.
Yes.
You just get a lot better. But what makes this interesting to me, when I met Taylor, when I met you, it was you're a nurse. You're going to be helping me with some of my bandages and some of the stuff going on my legs. So tell me a little bit about it. You're a regular RN, but what is this other interest? What is this laser stuff? How did you find about it? Yeah, how do you find out about a laser? What's this laser stuff? Why do I want to get involved with it?
Right. The first time I really heard anything of lasers was moving to Hawaii, and laser hair removal sounded pretty awesome.
Yeah.
So we're all in swimsuits all the time, and hair removal is pretty fun. So
is
that's
it
the first I heard
when you have hair remove laser? Is it like one time and then come back?
No, not usually.
Okay.
It takes a few treatments, and depending on the person and how they react to it, it can take quite a few treatments.
But I mean, what a cool thing to learn about and then actually be involved in doing it.
Absolutely.
Yeah. And it's Doc, when you say some things are cosmetic, this is one of the things in your office. It's a cosmetic.
Yeah. Considered purely cosmetic.
Okay. Well, let's paint a picture then, Taylor. Why should people come in and have this done? What is it that you do?
What we do at Vein Clinics of Hawaii, we definitely, like Dr. Juleff was just saying, help people, achieve a goal of something. It's usually very personal to that person, whether it be from a scar, acne scars, hair removal, dark spots, aging, the sun. We're all exposed to the sun here, and we get that sun damage, and mostly personal.
Where were you when you first got involved in it? You obviously have adapted to it because that's what you're doing now. It must be, way past the experimental stage. When people come in now, you're the lady. Yeah, I'm gonna do this. What is the thing you do the most? What procedure do you do the most?
Two things I do the most would be skin resurfacing and hair removal.
It sounds like, wait a minute, that sounds like it's going to hurt a whole lot. Skin resurfacing. Is that like sandpaper?
No.
But obviously, Doc, it came in like some of the things in your part of what you do is one tool or one procedure replaces another, and it's more effective and it's less painful, less invasive.
Right. And I think less invasiveness and diminishing or decreasing downtime for the patient to achieve a goal is one of the most important things that we concentrate on, and it really has had an effect on how lasers have been developed, over the course of the last 20 years as far as treating cosmetic issues. Some lasers can be, completely destructive of the skin. Now, that's going to ultimately achieve a goal of, smoothing the skin, and because your body is forced to regenerate and renew that most superficial layer of your skin. But there are other ways to achieve that too, a less aggressive way in that way, and we sort of have concentrated on that. How can we achieve a goal but keep the level of aggressiveness to a minimum, and therefore the downtime? And, when we talk about downtime, what we're talking about is, some very aggressive lasers bring about such a reaction to the skin that people aren't able to even go out of their house for a couple of weeks. Well, most people aren't able to take 2 weeks off and not go out of their house.
I should say. So what I guess, Taylor, that does for you is people develop a leap of faith. They hear one thing, and it's maybe like when you talk to a patient whose mom had her vein stripped and was in the hospital for 3 days, and you say, well, that's not going to happen here. You're done. You can go home now. So what is it like when the patient finally gets it, that what you're going to be doing is minimally invasive, it's not going to be hurt, you're not going to take 2 weeks off of work, but you're still going to get the same result?
Yeah, absolutely. We, in the consultation part of the process, try to explain this is different from those more harmful lasers that Dr. Juliff was just talking about. The recovery time for this is maybe 24 hours. Once you wake up the next day, your face should be calmed down and ready to go.
Okay, so in other words, gals and guys, you're gonna meet with Taylor and have this done on a Friday, and when you go back to work Monday, you don't look too bad,
right?
Or whatever it is.
Yeah.
And why? First of all, obviously, you had to have gotten trained. So talk about when you first developed the interest of, this is for me. I want to learn how to do this. I want to make people feel better, look better. What sort of additional education did you need to do that?
Definitely. I trained under Dr. Juliff, and then also, our specific laser manufacturers and company that we go through.
I bet they love to come out and teach, especially come to Hawaii, right? Yeah.
My training, was mostly under Dr. Juliff. He's been so helpful and most knowledgeable about it than I can say so myself, but I always learn from him and ask questions if I have, but I've learned a lot and I feel good about it.
Well, Doc, one of the things that I had to learn, and you ramped me up on that, and that is, in your practice, whether it's vein surgery or laser, everything has a price tag, and everything in your place is pretty expensive. So obviously you have to think long term, and you got to think, how can we do this? How can we get this great equipment? And how can we make it so people can afford to do it? Because, if you have something that can do something, but it's going to cost $4,000 a freckle, you're not going to have those freckles removed, right? So how does that work in the expansion of, say, in the vein clinics of Hawaii, to make that decision? Okay, we're going to go into this. We're going to have some fun. We're going to increase people's self-esteem. We're going to make people look better with a laser.
Mm-hmm. Yeah, well, there is a dollar and cents part of it. There's no question about that. And because, these laser machines are not cheap. And we have two different laser machines. Well, we actually have three different laser machines. And each one of them addresses slightly different problems and are, kind of individualized depending on what the patient needs and their skin type and all that sort of thing. But,
wait. Would you use one of the lasers that you do the vein stuff on? Could that also be used for doing something cosmetic?
Typically, no.
Yeah, so that means you need a lot of equipment.
Yeah, right.
Yeah.
We have to, you have to pick and choose. You have to decide which machines you're going to invest in, and which ones are going to be most useful for, your patients.
Taylor, that's where you come in. You got to tell Doc, hey, Doc, there's a new one. I just read about the new one. Can we get the new one? No, but I think that maybe I want to go back to this because I think that there's plenty of people out in the audience that wouldn't necessarily be skeptical, but would be saying, well, this is all this new high-fangled stuff. What's it really going to do? So let's walk through a typical consult when somebody comes in. So that means obviously they're interested. They might be shopping or kicking tires, but they're a warm body and they want to talk to you. How does that conversation begin?
Yeah, so first we would just ask what their concern is.
Yeah, what are you here for?
Right, what are you here for? A lot of it here is sun damage, fine lines, wrinkles. Luckily with one of our lasers, the Icon laser, we have a 3-for-me treatment, which...
A what?
3-for-me.
Okay.
That treatment it's 3 treatments, or not 3 treatments, excuse me. It's treating 3 different things. It's fine lines, wrinkles, sun damage, and it's also kind of resurfacing the skin there.
Yeah, so that the more you have done at one time, the more reasonable it is, right? Okay, so 3 for me.
Yeah, so that is a non-ablative fractional laser and an IPL laser. So we're using 2 in 1 treatment.
I have no clue, Doc. She's the RN. What is he talking about?
Yeah, write all that down because there will be questions later.
Yeah. There's a quiz.
Yeah, but I think, and just by way of Taylor taking over our laser stuff, she hadn't really been doing that before. I mean, she's been a nurse for a while. And her past professional life was mainly ER and
post-acute care.
Yeah. So, fairly clinical, institutional kind of stuff. But she really has taken over the cosmetic part of our practice nicely. And, she had to go through a fair amount of training. Not only from the company, but also education and that kind of thing. So,
I'm sure, Taylor, I'm sure that, the manufacturers, like I said, they have a vested interest at their machines being able to use for the max. I mean, to do as many things as possible. So that it's an interesting ramp up for you because they certainly know their stuff. So you get the opportunity to get with them. Now you're going to learn their stuff.
Yeah, absolutely.
Yeah. So how long have you been doing this?
With Main Clinics of Hawaii since January.
Okay, so have you already had some repeat visitors?
People absolutely.
Yeah, because I think that one of the things that would interest most of the listeners, and I know that we're all vain, we all want something done, but we're talking about the little fine lines mostly, and I'm guessing ladies, particularly eyes, nose, face, and stuff. How's it work?
Oh, absolutely. In sense to the repeat customer, usually after, your first few treatments, you feel pretty good and you're looking really good. Yeah. So after that, we can say, come back, 6 months, see how you're doing then. If you're still feeling good, come back in a year. Maybe we can do touch-ups or... Yeah,
and I know this comes up from time to time, but I know, and Doc, you can chime in on this one too. Is there sometimes confusion between laser and Botox?
No, usually people that are in interest of Botox, it's pretty specific towards them and a lot different than the laser.
Yeah, pretty interesting, Doc, because I do know that there's some modalities or some treatments that scare people. Story comes out and they, I don't want to do that. Yeah. So how do you explain the risks versus the value or versus the success on what you do? Do people want to know, hey, what side effects are there? What can go wrong with this?
Well, we go over that with people.
I bet. Yeah.
Our clientele actually across the board, they've become fairly sophisticated. So with respect to, do they know the difference between Botox and fillers and laser and IPL and all that sort of thing? Many of them do. Many of them do. So there really is a minimal amount of education, I would say. Taylor, would you agree with me?
Yeah, I agree.
When when we see a new patient and we're trying to investigate what they want, many of them are very specific about what they want because they've had stuff in the past. So there's not a lot of confusion. Botox is a medication that's injected into facial muscles to achieve something that's going to result in less wrinkles and that kind of thing to the face. We also will be doing what's called fillers as a general topic, and that achieves something else. And then, like we've been talking about, we're offering lasers and IPLs, and with respect to how they are different. It's all light energy. You know, lasers have to do with light, the transmission of light, and that light creating an energy source that's going to affect something. You know, lasers are pretty specific. You know, each laser has a little different wavelength, and that wavelength is directed toward a molecule.
I think people get really excited when they find out how precise it is.
Oh, it is.
You know, it's a lot more
very
than
much
hit and miss.
so.
Yeah, because the other thing, you know, Taylor, which I'm interested in making people know that they're going to make their mind up, is that back in my day when I was a young man, if I had wanted to do something cosmetically, you either do it word of mouth from a friend or somebody. But now we have this wonderful platform called the internet. And I would imagine that, like Doc was saying, that when people come get the consult, they got a list of stuff. They already know what they want to do. They just want to say, the 4 words that you hear the most is, how much is it? Yeah. Right? Is that a kicker? Well, you know, it depends. And I'm guessing that people, when they finally do a procedure, they're so stoked they come back for more.
Oh, absolutely.
Yeah, I love that.
Yeah.
You must like that.
Yeah, I do. I love, from my background, I love seeing patients again and again. Yeah. I mean, I love to get them better, but I do love to, you know, build that relationship.
Well, maybe the first time you see them, they're on a gurney, and the next time they walk in, you know, which is a little bit more fun.
No gurneys here.
No, but seriously, I think that's important because, Doc, you'd have to agree. We've talked about this yourself in your practice. In order to have the Vein Clinics of Hawaii and the number of locations, the number of people, each spot has got to have its people in it. So to be able to provide this service, you know, with Taylor that's just another good thing that this office can produce.
Yeah. And you know, most of our cosmetic activity is done here on Oahu. We also are doing some laser, procedures on Kauai. As of right now, we don't have that kind of activity in the other islands, but it's been kind of nice having all of that in one location, especially here in Honolulu, because we can offer those types of things to a pretty large number of people.
If somebody comes, Taylor, into the Honolulu Vein Clinic from the neighbor islands. Are there any conditions where it wouldn't be a good idea to have a procedure and go get it on an airplane, or is that all okay?
Oh, yeah, that's perfectly fine.
Which means you neighbor island people, don't fear. You can come on over here, go to a concert, have a couple of fancy dinners, get lasered, and go home.
Yeah,
but it is becoming common, isn't it? That when somebody, I want to talk about once again your repeat clients that come back in and just. How good can they feel? Well, they just keep feeling better and better. Talk about some of those things, what people tell you, that when they get back out there that I went and played tennis today, or I went to the beach. I didn't wear any makeup.
Yeah, I just, had a client the other day and was like, everybody's complimenting me on my skin, and it's so great. And every time it's getting a little bit better, and then having that patient come back in and seeing the results and seeing if, we're at a good standpoint, if they feel really good about it, then,
when somebody comes in to have a laser procedure, how long of an appointment usually is it?
Depending on it can be anywhere from 10 minutes to an hour.
Okay. So in other words, you're not going to do like with veins, you do maybe what a guy can handle or a gal can handle. But maybe with this, it's a little bit different.
Yeah, absolutely. Yeah. And that also has a lot to do, you asked the question, how does this feel? Like everybody wants to know that. Most people describe this as rubber band snapping.
Yeah, we've all done that.
On your skin? Yeah.
That's not too bad.
And we try to mitigate that even more by using, a topical analgesic to numb the skin a little bit. So there's even less of that feeling.
That's good. Is there anything that requires ongoing medication? If somebody goes home, I mean, are they going to be in pain? Are they, is it just a standard? We'll take a Tylenol or a Motrin if you feel badly. Do they?
A lot of times after a procedure, it can feel like you were just in the sun for a few hours.
Okay.
And your skin can be kind of red afterwards. So for medication wise, no, aloe.
Yeah. But I think that's important, and I guess that people learn it as fast as they can go click their mouse. And I basically, because I deal with a building company, people come in with snapshots of what they want. I'm guessing somebody comes in and says, "See this? can I do that? Can you do this for me? How do you deal with that kind of a client or patient?
Oh, absolutely.
Yeah.
Most of our getting cosmetic clients anyways is pictures showing people's before and afters that this stuff actually works, and getting them actually in front of me to talk about if it will work for them or not, because we like to be honest.
Yeah,
so.
and Doc, I think that the reputation of your practice and your clinic and your people is based on that. Here's honestly what you can expect. Now, if it goes over and above that, bonus.
Right.
But I know that some people say, when they have cosmetic. The spider vein thing, which is an elective procedure, right? Are they going to be completely gone? Well, I don't know.
Yeah. Well, managing expectations is a very important part of what we do. I know every time I go in to get a haircut, I take a picture of Brad Pitt with me, and I say, "Hey, can you make me look like this?"
And they say, "Yeah," but they're looking at look at this guy wants the impossible.
So that's unreasonable expectation. But I think that in most of what we do, we achieve pretty good goals, whether it's veins or lasers or whatever. But nothing's ever perfect, and the patient has to know that. And we try to be brutally honest with all of that.
Well, one of the things that I think is important, and Taylor, I've noticed this because right now I'm going through several treatments, and I've noticed that when I see somebody in the waiting room, that immediately you have common grounds. I was talking to this one guy yesterday. I was in there for an appointment. It just turns out, or day before, whenever it was. Anyway, what was kind of neat was there was a guy wearing his compression socks, and I brag about me wearing mine. And I said, you're not supposed to wear those only when you come in to see the doctor. And he gave me that look like I know. I'm interested in what some of the patients that you have, what you've heard them saying to each other. Let's say you're finished with Molly and Sally's waiting or whatever, and they cross in the hall and they've seen each other. What are they willing to share, and what do you hear from them?
Oh, absolutely. A lot of times if it's crossing paths in between appointments, somebody comes out with a little bit of a red face and they're like, oh, how did that go? Did that hurt? And usually it's no, it didn't. It was, comfortable the whole time and, share I'm having good effects or, how long or how many treatments they've been doing. And that really depends person to person.
We are so much more outsiders here in Hawaii. And I do know that the sun can be charged with doing a lot of this damage. Do you think that some of your clients and patients start making, maybe it's not a good idea for me to do that quite as much as anymore if I want to keep looking like this?
Oh, absolutely. Because a lot of the, pre-conditions and post-conditions of getting laser is staying out of the sun.
Yeah.
So
dermatologists love to hear that, don't they, Doc?
Yeah.
Because they think the sun's poison. Well, a little bit you need, right? For vitamin D is good for you.
Sure. Yeah. A little bit of sun is good. Yeah. But, our overall consciousness of how bad the sun can be for us has changed a lot over the last 20 years. I know when I was young, nobody thought anything.
Who cared? Yeah. Now you find out one sunburn can manifest 20 years later with the melanoma.
Right. I remember when I was young getting burnt to a crisp. Well, nobody these days, nobody would allow their children to do that.
I hate to tell you this, but back in the day, it was Monoi oil from Tahiti.
Yeah.
And we would put a couple of drops of soy sauce in it so that you really what you were doing was cooking your skin. Okay. Yeah. One of the things I've been dying, Taylor, ever since we started talking, and that is I've learned now, not just because I never had any vein surgery done strictly cosmetic, because it just never really bothered me that much. But now I have had some done. So I want to know if you're seeing an increase in men coming in, because I'm guessing absolutely yes.
I think about half of my patients right now are
that's fabulous. I would have if you'd have said 30%, I would have been impressed.
No, about half.
Wow.
Yeah.
Doc, we're waking up.
We want to look good too.
You know why? Because it doesn't hurt really a lot. You don't miss it. You're not staying. You don't have to be a hermit for a month.
Right.
So but can you make it gradually? Like, let's say a guy comes in and he's got gray hair. And you can make him a blonde, but it'd be a good idea to do it gradually. Is this something that is also done gradually?
Yes, absolutely.
In stages.
But out of necessity. It's not, and that's the thing with. most of our vein patients, we come in and we treat something, or they have something treated and it's done.
Right.
And now that's not to say that they, we have to follow in the future and make sure new things don't come up. But with laser, it is very much a stepwise fashion. One of the most common things we do is hair removal, and everybody responds a little differently to. Depending on what the patient's skin type is like and all that sort of thing.
Do men do hair removal?
Oh yeah.
Okay.
And
second.
It's never a one shot deal. Whether you're looking at hair removal or skin resurfacing, typically it's a series of events. And especially with hair removal, if it's if it's being difficult, it may take up to 6 or 7 visits to achieve what they want.
Okay, I got the dropper here, Taylor. Let's talk about. I knew this one gal when we were kids, and she used to get teased. She was a beautiful girl, but she had a mustache. And I'm guessing that a lot of that hair removal is that kind of hair removal.
Yes.
Oh yeah.
Yeah, and she. Too bad this isn't TV because Taylor's got a big smile. That must mean that this is where you see like almost something instantaneous, isn't it?
Yeah, that's so funny that you mentioned the mustache because I mentioned to Dr. Juleff, Dr. Juleff, I have a mustache and I need to get rid of it, and I've had it. I've done my mustache and had great results. So
and I guess that what were the options in old is they shaved.
Yeah,
and I this girl. All the way through high school, kids are unmerciful. Right?
Oh yeah,
absolutely.
They're terrible,
and that only made it worse.
Yeah, of course.
Shaving. Yeah. But the laser is a really good remedy for hair removal. I was thinking before that there are some things that we do that make life more convenient for patients, and hair removal is one of those. But hair removal can very much be a cosmetic kind of thing, especially for women with facial hair. But we do a fair amount of that. We've started doing a fair amount of tattoo removal.
Yeah, and that's a really, I'm so glad you brought that up, because in the back of my mind I was going to get to Taylor on that, asking if some of these people that have maybe buyer's remorse or regrets. I had this tattoo when I was 5 years ago, and I like this guy named Bobby, and I put this Bobby over here. Now what am I going to do? From what I understand, this is a growing opportunity in surgery and everything, because there's so many people that are so unhappy with these things, they want them gone.
Yeah, I mean, there's a whole host of people out there that not only 5 years ago, but had a tattoo put on 30 years ago. Yeah. And as we age, those tattoos tend to, migrate. They turn into something different. It used to be a lily, now it's a pumpkin.
How is a laser used for that? How does it work?
How does for tattoo removal? Yeah, so our Pico laser is what we use for that, and it heats up the particles, the tiny pigmented particles,
and which otherwise would be permanent, right?
Correct. And that energy is delivered so fast that it makes it break up and vibrates and shatters, and then our body gets rid of that through our lymph system.
It's amazing, because there's a leading dermatologist that used to work in Hawaii that's back east now, writing books and everything else. I mean, and giving the opportunity to people to understand that, what costs $50 to put on, one night in Chinatown it's a lifetime.
Well, yeah, it's a lifetime.
And it costs a little more money to take them off than put them on.
It's going to cost a little more to get rid of it, but I mean, Taylor mentioned the Pico, and we just recently got that laser, and it's turning out to be very, very useful for other things, but also for tattoos. Tattoos are basically just pigment molecules in the skin. I mean, and they're tapped into the skin, and they're permanent otherwise. But the thing that bothers me, excuse me for interrupting, but this kills me, is that we know that our skin is a living organ, and it's regenerating all the time. Yeah, but not with a tattoo. Right. I mean, what did it circumvent the tattoo? Just go around it? Yeah. Well, the pigment is in the deeper layers of the skin that don't shed the way other layers do. But the Pico laser is a newer kind of laser, and rather than most lasers use heat, they generate heat. to create an effect. The pico is more of a mechanical thing. So the wavelength of the laser is directed toward specific color of the pigment molecules that are put into the skin in the course of a tattoo, and rather than heating it up, it explodes those molecules.
It blows it up. Yeah.
Which is a really cool concept, and makes it even more effective. And we've had tremendous results really with that pico laser getting rid of tattoos.
Now I know, I'm sure, Taylor, that what they all want to talk about, is it completely going to go away? And I do know that there's probably some that would be pretty hard to get rid of all of it. I know some people, by the way, are re-tattooing over an old one, because they just want to get it covered up. Shouldn't they look about getting it removed?
A lot of even the recover-ups, getting one treatment of laser removal for your tattoo before you get a cover-up can help that cover-up look better, even things like that. So some people even just come in for one. Let's get it removed a little bit and go and get a cover-up tattoo.
Doc, would you have ever believed a few years ago that this was going to just explode the way it has across all social media groups, all ethnicities? I mean, tattoos are like...
Oh, yeah.
I hardly knew anybody when I was a kid. That now everybody, it seems good.
Yeah, almost everybody has a tattoo in one place or another,
don't
whether you can see it or not.
Don't put them on your forehead if you want to be in customer service. But so is that a growing segment, Taylor, of people that come in accepting this laser treatment for tattoo removal?
Absolutely. And I think with our Pico, this laser specifically is requiring less treatments than what lasers in the past used to. We're seeing almost complete results in 3 treatments rather than 11 of what people used to have to go for.
Wow, that's great.
Yeah, and the results are good. Now, we still have the tattoos that respond the best are darker inked tattoos, the blacks and the real dark blues. But the more color you get into the tattoo, the less you're able to kind of eradicate the thing completely. But yeah, we can actually do a very good job getting rid of it if it's the right kind of tattoo. But getting back to Taylor's comment before, that's a real important option for people if they have a tattoo that they don't like, and it's a tattoo that may not be able to be eradicated completely. Often it's very beneficial for them to come in for a couple of treatments to lighten that tattoo as much as they possibly can, and then have a new one put over that.
Here in Hawaii, and I know, Taylor, I'm sure you're seeing this, we have such a diverse ethnicity and racial and everything else that there must be some people saying, hey, I heard that this was like only good for, white haole girls,
Yeah.
But in actual fact, I'm just guessing that once you know the condition that you're dealing with, there's ways to deal with skin colors and skin conditions.
Yeah, absolutely. Getting somebody in for a consultation, seeing their skin tone, going over, how they react to sun, light, things like that, everything. We have really safe options for people with darker complexions.
Yeah, that's interesting.
Not just for,
but
white girl.
But the other thing is, of course, and talk about maybe some of these things are, obviously cosmetic, but there are health benefits. I mean, if they get them dealt with. For instance, Doc, I think we talked about earlier, and maybe you both can discuss this. What about things like skin conditions like eczema or like maybe acne or some of the other things that this might be a treatment for?
It is. Yeah, there are things like that. Acne, but also precancerous lesions many people, most people, especially living in Hawaii, they've had so much sun damage that they may have precancerous, little
guys
things.
have melanoma on top of their melanoma. I mean, layers of it.
And some of the things that we do can be very effective with as far as getting rid of those things. So there are medically related things that we do with the lasers.
What I'm interested in Taylor, because you deal with the patients and you deal with the treatment, is that I would guess that there's some patients that come in for one procedure, had no idea that they can have a different procedure for a different condition.
Yeah, absolutely.
Like for instance, the lady with the mustache also might have a scar, and I think that a lot of people are scar conscious. What can a laser do to help, mitigate or lessen or change a scar?
Yeah, absolutely. I think less saying scar removal, scar reduction is the best thing. You can really lighten scars. seen good results with that. Scars, including acne scars, surgical scars, stretch marks are scars.
Yeah, exactly. I was going to ask about that because obviously stretch marks, Doc, is everything. I mean, and I know guys that have stretch marks too. It's not strictly if you look at this, but and I know that with nowadays, because I know myself with my own personal experience, a lot of people that have bariatric surgery or other surgeries all have this skin that's doesn't want to go back in. So people start thinking, well, what am I going to do with all of this stuff? You know?
Yeah. Unfortunately, we don't have a good technique.
No nip and tuck, shave and haircut. But however, it's just the appearance of the skin. Don't a lot of women, Taylor, get after childbirth a couple of times when they've had these stretch marks? It's just, I was able to lose the weight, but geez, what can I do about these things? What can they do?
Yeah, absolutely. Come to us, have a consultation, and see what we can do.
With respect to scar lessening, one thing that we've learned is that if you have a scar that you want to, lessen the appearance as much as possible, it's best to address it early on. So,
point.
rather than waiting for years and letting it kind of develop. It's actually better to address it not a very long period of time after they've had surgery. So, there's plenty of people out there that are having, little incisions or whatever on the face. And the best time to address that is, a short period of time after they've had surgery to lessen that scar as much as they possibly can.
Yeah, and that must be another thing because I'm sure that you see sometimes, Taylor, when a patient or, a new patient comes to you, is that they've had some procedure done of some kind in the past that didn't work out too well, whether it was scar removal or what do you call it? Nose job,
facelift.
Facelifts, all of these things.
Yeah, sure.
So I would imagine that some people have really high expectations. So go back again to the consultation part when you're feeling out what this patient is looking for and how do they start feeling when you can start giving them, oh, yeah, well, here's how this would be handled. Here's how this would be treated.
Right. It's definitely my most important thing is setting goals with the patient, what they're looking to achieve out of this, and what we can offer for them to help them achieve those goals. So personal and individualized patient to patient. That's why, we do the free consultation to get somebody in to talk about it. Let me see your skin. Let's see. Let's do a test spot, see how that works. And
by the way, when we say free consultation, you need to know how to do that. So I just recommend just going online, look at the website anyway, and see some of the great things happening. It's veinclinicsofhawaii.com, veinclinicsofhawaii.com. There's phone numbers for each different location. And the particular location that we're talking about with Taylor and Doc Juleff today is the Honolulu location in the Ala Moana building. And that's where I go.
Yeah. I just wanted to make a comment. Taylor just alluded to doing a test spot, and there are there's a whole spectrum of skin types, and you sort of talked about it a little bit before. Some lighter skinned people, it seems like you can do just about anything to, and they heal fine without any negative repercussions. People who have darker skin, and obviously in Hawaii, there's
we have lots of grades of that.
A huge spectrum of grades, and it's a little trickier to handle the darker skinned person. And Asian skin also is, you have to be very cautious and take it in a very deliberate, stepwise fashion. So two of the things that we do are, number one, the Pico laser that we have is a laser, specifically, developed to address all skin types. So that's why we've started using that so much. And also, if somebody comes in and we're not sure, usually we just do a little, what Taylor said, test spot. Just a tiny little area and make sure that they're going to respond okay and before we do the whole thing. And that gives the patient a little more reassurance as far as what they're getting themselves into.
I can see people out there because I can see you. I look right through the radio and I know where you are and what you're doing. And there's a lot of people when they say it's the Pico laser that are thinking of the belly button because we call the Pico the belly button.
Oh, okay.
And so this is not necessarily a belly button laser. Probably could be used there, but it's called the Pico.
If they've got a tattoo around their belly button, it'll work.
Fixed. But I think that it must be fun learning, Taylor, as you have, the changes not just in the machines themselves, but in the different people that have experimented on different things that then become not experimental but valuable. So it must be adding to your repertoire all the time.
Yeah, no, I definitely love it. It's part of nursing, of why I fell in love with nursing, is the different things that I get to, expose myself to and help people with.
When you have somebody that does one of these test spots, generally how quickly do you know whether it took or not? Does it take a little while? Can you see right away?
Depending on which laser we're using, I usually have them come back 2 weeks and see how their skin is reacting.
I think, Doc, what's interesting, and Taylor said this, and I'm sure this has got to do with the way you run the business side of your business, and that is concise records and files, because it seems to me like somebody might come in for something just totally fun and good fun, but you're going to have a file on that. You're going to know what happened, when, and all that stuff.
Yeah, actually, that's a good question and an important point. Yeah, every time that somebody comes in for a procedure, we're very specific in our documentation, because we're using, even though a laser does a particular thing with a certain wavelength and all that sort of stuff, there are still decisions that we're making with respect to the amount of energy and time and all that sort of stuff. So we document all of those things with each patient, and then we can adjust as needed. If they didn't get quite as much of an effect as we wanted them to, then we up the energy a little more, or vice versa.
Yeah, that's the key. When you talk about that, Taylor, please explain that, because as the operator of the equipment, it has a little bit more, and plenty. So I mean, you have to determine. So how do you make that decision based on, what if I were a patient looking to do something about lines around my eyes? Knock on wood, I don't have too many for an old dude. But seriously, you need to have people get some sort of an idea, not just the how much is it part, which we talked about earlier, but okay, when are we going to get started, and how long is it going to be, and what can we do first, and
absolutely. Once we get that test spot, see how you react to that. We start more conservative and, go from there and build from there. Depending on the treatment, recovery to when you can have your next treatments, anywhere from 2 weeks to 8 weeks. Once again, depends. Hair removal's longer, things like that. So
the manufacturer gives guidelines, obviously, and that's where we kind of start. However, we have to go on our own experience, and also, kind of monitor how the patient is responding each time. But it's kind of a number of things that we utilize to figure out where we're going to start with any one patient with respect to how we're going to utilize that laser.
Okay, now, gang, if you're just tuning in, we're not talking about venous surgery today with Dr. Juleff. We're talking with Taylor Busker. She is a registered nurse in the office and also has osmosed into being in charge of the laser procedures. And these laser procedures are basically it's elective work, elective surgery. And the applications are terrific. We learned a little bit about mustache removal for ladies and hair removal, and I'm sure a lot of that has to do with the ladies come in that are beach ladies that want the bikini lines and all that kind of stuff. I'm more interested on how you've dealt, now that you've been there doing this for a while, how you've got a patient that comes back for the next step and says, hey, by the way, what else can I do? I'm so happy with all this stuff going on. And by the way, here's my sister. She wants some stuff too.
Word of mouth is definitely our best friend. I think people are actually getting really good results, and that's VeinClinicsOfHawaii.com. That'll get you started. I know you send a lot of people to that. So generally speaking, much like Dr. Juleff when he has somebody in for a leg procedure, if you're going to be in and have a procedure, it's going to be anywhere from 10 minutes to an hour, but never more than that, right? No.
Yeah. And typically, what is the icebreaker for most people? What brings the most people in to talk about laser?
What brings the most
people?
Is
it hair removal? Is it is it lines? Is it scars?
I think it's hair removal and fine lines and wrinkles. The sun damage, the dark spots that we get are my most common that we have. But we also get anything from people that have rosacea, hyperpigmentation.
Now, Doc, isn't there a difference in some of these things? Maybe they wouldn't be quite so elective, that they might be an actual medical treatment that is done for a medical condition?
Yes and no. Like we were talking about before, sometimes people can have, dermatologic problems with their face that, they're going to be benefiting from, from a medical kind of standpoint. Unfortunately, even in those situations, insurance doesn't cover it.
Yeah. Well, we know from other discussions that insurance companies are not trying to invent new ways to cover stuff.
No, they are not. But, I think probably, I would say hair removal is probably number one, wouldn't you say, Taylor?
Yes.
And then also sun damage just in general. Now, many people come in with, pigmentation and, blue spot or brown spots and red spots. And, the lasers that we have do a very good job with
Can't some of
minimizing
that, Doc, can't some of that either minimize or eliminate a worse situation going on there if you don't treat it?
It could. It very well could. Sure. Yeah. And I think and then fine lines and wrinkles, and I think especially sun damage with respect to pigment and fine line and wrinkles, which are also kind of fall under the category of sun damage. I think people become the happiest about that because it really does change their appearance.
Taylor, what about that we have so many people that in the hospitality area work outside. We got surfboard instructors, we got beach attendants, we got gals, working around the pools and servers and everything else. They're in the sun all the time. This must come as a real blessing for some of them.
Yeah, absolutely.
Yeah. Give us, for instance, if you get continually sunburned, you shouldn't be in the sun. We know that. But what remedy is there if you've got these conditions that were brought upon the sun, by the sun?
Well, sunscreen.
Yeah.
And then also, we can, treat some of that with lasers. If we get you out of the sun for a few weeks and calm down that browning of the skin, then, we can use laser treatments to help that.
And that's an important thing, with respect to educating the patient for the future, because, a lot of people will come in and have these procedures done, and then they're back out in the sun again
the next day.
And but it's so important. Taylor just mentioned sunscreen. But you have to protect your skin, especially facial skin, and especially in a place like Hawaii.
What about other things? I do know that I had this friend. His name was, they called him Corky when we were kids, and he was one big freckle. His whole body, he was like freckles. And I know that with fair skin and redheads, particularly, that's an issue. Is our freckles something that get dealt with laser treatment, or can they be?
That's a good question.
See, I get paid big bucks for asking these questions.
Yeah.
And by the way, none of this is rehearsed. If we had to do this show over again, it'd be completely different.
Yeah. We've never. I don't think we've ever treated somebody for freckles.
Okay, so do I have a freckle volunteer out there?
Yeah.
Go to veinclinicsofhawaii.com. Come in. We'll give you a spot check.
We'll do a spot test.
Exactly. We'll get rid of one of those spots.
Yeah.
I think, though, that, it sounds to me, Taylor, I do know that as an RN and previously working in ER and everything else, that's when you see things that are really, kind of tough sometimes, right?
Yeah.
This must be very gratifying in that what may not be health threatening, it might be lifestyle threatening or self-esteem threatening. I'm more interested in having people walk out of there saying, "Bring it on, world. I'm ready to face you a little bit better than I was yesterday."
Yeah, definitely. Yeah. I think being a nurse is getting somebody to feel better, whether that be, from a broken bone or, your self-confidence. And that goes